starting with blood testing. So this is the conventional wisdom of testing in the body. It doesn't tell the whole story because your blood is in constant flux. It doesn't really reflect the lymphatic system of the body, certainly, and all the different tissues of the body. It's just the blood. So there's a lot of different things you can test. Now, I have tried to figure out, the most comprehensive things to test, and so I'm just going to rapid fire, just fire through them. If you're ever considering getting tested, maybe consider testing for these things. So one is blood sugar regulation. That would be your glucose, hemoglobin A1C, insulin. Testing for kidney function. That's your creatine, BUN, EGFR. And this is not an exhaustive list, but I tried to get most of the lion's share. Your mineral and your electrolyte levels. Testing for sodium, potassium, chloride, carbon dioxide, calcium, magnesium. Testing for liver function. Albumin, globulin, bilirubin, alkaline phosphatase, AST, ALT. Testing for your vitamin D3 levels. This is a huge one, with so many people being at risky levels, low levels. Testing your cholesterol levels and your triglycerides or fats. Testing for levels of inflammation, testing for homocysteine, an amino acid, C-reactive protein. How about testing for thyroid function, your TSH, T4, T3, TPO, TG? Testing your hormone levels, cortisol, testosterone, LH, FSH, DHEA, sulfate, estradiol, insulin-like growth factor. How about testing for blood health? That would be your CBC, RBC, hemoglobin, hematocrit, hematocrit, MCH, MCHC, RDW, and platelets. And how about your immune system function? That would be your neutrophils, your lymphocytes, your monocytes, your eosinophils, aka EOS. All right, now you can get a pretty comprehensive blood test for around $100, but it may not include all of these different measurements. You may have to get additional tests, a la carte, or maybe you can find a practitioner who can order all of these tests in one draw. You do have to go into a lab to get your blood drawn to do these. I'm not a huge fan of doing this. I've heard of people getting blood work once a month, or maybe they're taking IVs once a week, and I'm not a huge fan of, stabbing yourself in the artery and with a tiny needle. This obviously creates a very small wound that has to heal, so you're sort of mildly injuring the body. It's not anything to be a wussy about, but I'm just saying, there is some downside there, so I wouldn't want to do it all super frequently, but it is also helpful to work with a practitioner who can help interpret the results. Obviously finding a practitioner who's well versed in full spectrum analysis is a challenge. By the way, if you need that blood test, there's one that's pretty comprehensive. It has most of those, and it's available at virtually all cities in the U.S. where there's a hospital or a lab nearby that hospital. rapidregeneration.com/blood test at a very reasonable cost. You could also consider one of the biggest problematic measurements that's found in a blood test is vitamin D3. You can just test your vitamin D3. You can do this at home. You have to prick your skin and get a blood drop and mail it in. And you can get 2 tests for about $100. You can find that at rapidregeneration.com/D3 test. There's a whole other segment about vitamin D3. It is shocking what can happen and how health can deteriorate if vitamin D3 levels are low. So wouldn't you want to know if that is going on in your blood?